So there is a numerous point. If you apply the stomach 36 on the surface level, it works for the stomach. If you apply to the deeper level, it works for the spleen. If you apply to the further deep, it works for the heart system. If you apply further deep, it communicating to all the organs. That is the beauty of the stomach. Due to that reason, the stomach 36, the people use only the meridians are existing on the surface level, not the deeper level. So that time we just apply the needling on the surface level. We don't test to the deeper level. That doesn't have the total therapeutic effect. So therefore, 2 tube needle or at least 1.5 tube needle is recommended to insert to the deeper level to the stomach 36 to regulate the overall energy. And also, patient should feel that Deqi effect. The patient need to realize that. So once you apply the needle, the propagation sensation feeling is always required. At the same time, you ask them to patient. See, due to that reason, we should not allow them to speak. Our neighbors should stay with them, or no relatives. He needs to focus the entire completion of the treatment, because acupuncture is the energy treatment. So once the energy is from where to where it is passing, from where to where it is reaching, this need to analyze once we close our eyes and then realize that yes, the energy is moving from here to here. Because if that feeling is there, that's really awesome. The patient feels more energetic. Patient feels that I'm taking the natural treatment. I need to motivate, because when we have seen that there are certain anti-corona points. So during the pandemic, we told that there is an anti-corona points. Every patient or every human being, it is essential to activate themselves. In that one point is the stomach 36. Right? Where that muscles are there, whether it is very obese person is there and connected to the before the bone, till that you can reach up to the tendon, up to the cartilage, that needle should go and reach to that muscles. You understand when there is a pain is there, pain is not only on the surface level, pain is connected to the deeper layer of the tissues. The 7th layer of the skin is there. So in that level, if the pain is connected to the cutaneous, or the pain is connected to the subcutaneous, or the pain is connected to the intramuscular, if the pain is connected to the cartilage level, or the pain is connected to the bone level. You try to touch and palpate, the pain is connected to the muscular level. If you touch to the supraspinal muscle, for example, giving pain on the shoulders, you 10 point. If the patient feel the pain that is connected to the muscular system is affected. When you apply to the smaller joints or any that particular radial bone, so that time patient feel kind of the bone pain. Then here is the 2 ways we understand both are affected. As per the arthritis, if we understand, of course this is both are affected, but depend on the condition, acute and chronic. So in that time when we wanted to treat only for the muscular system, then definitely you just apply to the deeper level of the muscles without touching to bone. It's not required. Now let me give one more example. The ankylosing spondylosis is there, where the sacroiliac joints are very badly affected. So that time you wanted to treat by using the half tune or 1 tune, definitely it doesn't work. So where is it affected? On the vertebrae and the multifidus muscles, that is the deepest muscles of the back. Then treat by using the 2 tune to 3 tune needle, communicating to the deeper tissues, so that deeper level you need to activate to increase the chi level which is existing inside the muscular system. When there is a retention is there, because of that retention chi is not flowing thoroughly in that particular region. When the body fluids are not synthesizing precisely, that leads to that problem. So therefore you just focus to that level. When there is the bone also affected here, then you understand we have to treat for the bone marrow. Bone marrow is nothing but we wanted to scroll and then insert the inside the bone. It's not like that. Because once you touch just to the bone, so that you are treating to the bone needling. Make sure that you sterilize the needle, and you should not very hardly, pierce the needle and then scroll. That should not damage the needle, because always you remember the needle also should be used very, benchmark standard needles are required. So FDA approved needles are more good than the non-approved acupuncture needles. Right? In that way, we select some serine needles are there, or we call as the E-acu needles are there. These are the very superior stainless filiform needles. Those needles are really expensive, and also that's really good to treat for the various types of the diseases. But make sure that what kind of the gauge are you using. The gauge should be thickness will be more. It's not that very thin needle. Patient should not feel the pain, but sometimes even our professor don't believe that if the patient doesn't feel the pain, that kind of the needling is not recommended. So patient should feel the pain to obtain the Deqi effect. So he should feel the sensation of the P propagation needling sensation pathway. The patient should feel that energy flowing that meridian. So that always is good. So in that way, without any hesitation, try to insert the needle to the, if there is the wrist pain is there, or the smaller joints are affected, or the interdigital, the phalanges are affected, and treat for the phalanges by using the half-tone needle to connecting to the bone itself. So once you treat connecting to the bone, there is a procedure of the needling. One is the cutaneous problem, treat for the only by using needling only on the cutaneous level. When there is a subcutaneous level, insert the needle around. Cutaneous is 15 degrees, right? Subcutaneous is 45 degrees. The muscular system 60 degrees. Then there is the deeper muscles, and then bone level is the 90 degrees. So directly you can insert the needle, and patient comfortable also very much important here. If the patient is okay once you are giving the needling sensation, if the patient feels is screaming, so that time definitely it is not recommended. Even sometimes is that Deqi effect happen by using there are the two major points which feel the Deqi effect by using the, one is the pericardium 6 is the neck one. So that point is the medial nerve you are communicating, that having the vasovagal tone effect, and there is that the medial nerve gets open, that causes some kind of screaming of the patient most of the times. The another point to be called as a full yoke, that is kidney 7, that point of the posterior tibial artery, midway between the K3 and the K7, you can find that artery is flowing on that particular region. The patient feels some kind of sensation on that region. So this is the Deqi effect. But whereas in needling, so once you touches to the bone needling having the bone effect. The tendon level needling having the tendon effect. The cartilage level needling having the cartilage effect. But overall for the musculoskeletal system, as per the TCM, so the point to be called as a Yang Ling Chuan. So that point to be GB34.